Welcome back, everyone, to Diabetes Awareness Month, where we are raising awareness for type 1 and type 2 diabetes around the world. With us today is Dr. David Reed. Dr. Reed is a general dentist running his own private practice, Westville Family Dentistry in Northwest Indiana. Dr. Reed has been practicing dentistry since he graduated from IU School Dentistry in 2007. At the age of 12, Dr. Reed was diagnosed with type 1 diabetes, and he has been kind enough to join us today to share his journey from childhood to adulthood. So, Dr. Reed, thank you very much for joining us.
Thanks for having me.
Can you give us a brief history of your type 1 diabetes, kind of what led to your diagnosis, what kind of symptoms you're experiencing, if you can remember as a child, and everything that goes along with that?
Yeah, I was diagnosed when I was 12, and no one in my family has any history of diabetes or knew anything about it at the time. I had all the symptoms for a few weeks. I was dehydrated. I was lethargic. My blood sugars were all over the place, and no one really knew what was wrong with me. My dad honestly just thought I was being lazy because I slept a lot. My mom finally found me. I'd get up in the middle of the night to go to the bathroom a lot because my blood sugar was elevated, and she found me asleep at the sink drinking water. And I think that was kind of a sign that she finally took me in to see the doctor. And then two, she got a call from school. I was falling asleep in class, which wasn't the norm. I was a good student. I didn't fall asleep in school. And she took me to the doctor. They ran their tests, and then they took me to the hospital and diagnosed me with type 1 diabetes. And I was 12. I didn't know what it was. And they're taking me, and my mom was a nervous wreck. I was just thirsty at the time. And I remember saying, okay, that's fine. Can I have a pop? And they said, well, you can't drink pop anymore. You can drink diet pop. And that's when it hit home at 12. That was the most crushing thing, I think, because I was told I had to drink diet pop. But then, through the week there, they educated us on it and learned all about it.
Sure. What was your initial treatment then? Like once you got to the hospital, you were diagnosed. What did the doctors kind of start you on as far as a treatment regimen, and kind of how was that?
So back then, that was 28 years ago. I took insulin twice a day. So I took and it was mixing insulin. So it was a short-term or a short-acting and a long-acting insulin that I would take before breakfast and then again before lunch. So you had to time your meals at that time. So I would eat based on when that insulin would act, and that would determine when I would eat and basically how much I would eat. And it was about the same. You try to eat the same amount of carbohydrates per se for each meal. And that's how it was done back then. And, since then it's changed. When I was maybe in college, I switched to using an insulin pen, which was just filled with short acting insulin. And then I would take a long acting insulin once a day. So then that was a little more freeing because I can eat whenever I wanted, and whatever I wanted, I just took a shot each time. To now I have insulin pump therapy where it's constantly giving me insulin throughout the day. And, I bolus how much I need for the meals I eat.
Sure. It definitely sounds like the treatment has progressed kind of as time has gone on. It seems like the technology is starting to kind of catch up with the disease processes, the more research is being done. Do you feel like a lot of that is the research that's out there now, or that we're understanding how insulin works better, or there's just better availability of insulin out there for use?
That's a good question. I don't know. I think we've understood it for a long time. I don't think the science has changed much, how it works. I think it's delivering it per se, but it's definitely come a long way. Yeah.
Well, have you found as you've gone through life, obviously this has been since you were 12 years old, so you've been kind of dealing with this for a while. Is there anything that you can't really do now? You mentioned you can't drink pop, couldn't drink pop as a kid, which for any kid is like devastating, right? But is there anything else really that you can't really do now that you could do either physically or otherwise, really, that you might have been able to do had you have not been diagnosed with type 1 diabetes?
No, I don't think so. And that's, I guess one of the, not a benefit, but you can live a normal life being a type 1 diabetic. It just takes more planning. I can do honestly anything, whatever I want. Swimming, I guess, might be a little more complicated. We went to a water park over the summer with my son and my wife, and you can't wear an insulin pump down water slides, so you take that off, but you also don't want to have that off for hours at a time. So there's some planning involved. Same with like, exercising or running or different things like that. You need to be conscious of what your blood sugars are, but it's still all doable.
Obviously, a lot of challenges there with having to plan everything out, and not just water parks, but I'm sure with meals and things of that nature. What would you say your biggest challenge is as a diabetic?
Just again, planning for things like planning. If you can't miss meals, really. You have to be cautious of that, because the one thing, if your blood sugar goes low, that's a problem. That can be an immediate problem. So you have to be careful to not skip meals, to always have something with you, I guess, in case of an emergency, in case your blood sugar goes low. Glucose, I always have in my office, I've got a drawer with glucose tabs and, different snacks throughout the day. My office manager jokes that I'm always eating. She comes in my office, I'm always snacking on something. Just, again, it's part of how I manage my diabetes, but it's also, I'm always checking my sugar to make sure that it's okay, because you don't want to be in the middle of something with a patient and your blood sugar goes low.
Sure. So
that's the big thing, is just monitoring your blood sugar and making sure it's within that normal range.
Sure. Right now, obviously, and over the past few years, one of the hot button issue is insulin and insulin availability, especially with type 1, and the ability to acquire both financially and logistically. Is it a challenge for you to acquire insulin? And if so, kind of what makes it a challenge? What is the biggest challenge for insulin acquisition for you?
I think the biggest issue with all of it is the financial aspect. It's my wife and I were looking at it. We have insurance, thankfully. But again, the insurance, they say pre-existing conditions, they can't deny you anymore. They can't deny you, but they can charge you whatever they want. So it's not financially possible for some people to pay those prices. I think we were adding it up. If I didn't have insurance, which the insurance isn't good, but if I didn't have insurance, it would be over $20,000 a year just for insulin and diabetic supplies, where a lot of people can't do that. And you're reading of these people that are rationing their insulin because they can't afford it. And I think what a lot of people don't understand is type 1 diabetics, if I don't have insulin, I die. That's it. Like, I can't live without it. It's like, and it's, the cost has gone up exorbitantly in the past 5 to 10 years, whereas the patent's been the same. So I'm not sure why the cost has gone up, but it's essentially the same as charging for air, right? I mean, people have to have it to live, and so I don't know how that gets rectified, but it is a problem. And to me, that's the biggest problem is just the cost of treating the disease and how they bring that down. I remember when I was getting out of dental school being concerned, like, well, how am I going to pay for this? Do I need to get a job that has insurance? Because, I've been denied multiple times trying to get insurance at that time, being diabetic, but it's, I don't know the answer to how you correct it, but to me, that's the biggest issue right now.
Yeah, I mean, I think that seems to be in a lot of people I've talked to have really echoed your sentiment is the financial burden that it does place, is, in addition to like the logistics side of things. And you mentioned it's tough to say what the way to rectify it is, but if you had to put your finger on something, would you say, as a medical professional, is it an insurance issue? Is it a manufacturing issue? Where really do you see this coming from, having grown up with this process and having dealt with the process of acquiring insulin for so long, and now as a medical professional, where do you see the problem lying? Or is it a combination of all kinds of different things where it's just kind of thrown into a pot?
Yeah, I definitely think it's multifactorial, but I haven't seen I haven't had an issue getting insulin. It's just the cost has changed. I've always been able to get it, thankfully. So I think it's, something with the pharmaceutical industry, something with the insurance companies, and I hate to say it, profit margins are involved,
Sure.
but
Sure.
I don't know where it lies. One story, I remember trying to get life insurance, and my wife and I were at a point we were getting life insurance, and I was denied multiple times, just because I'm type 1 diabetic. And my wife, I remember at one point getting upset with the guy on the phone. I was like, well, I don't understand. I mean, I work out 6 days a week. My A1C levels are phenomenal. I take care of myself. And I started getting upset. He's like, sir, I'm sorry. I'm just reading the screen. It says if you're type 1 diabetic, we can't insure you. So, I mean, and I remember asking him, like, we're all going to die, right? So you're going to pay out for everyone. It's just, I'm too much of a risk. And he's like, yeah, you're too much of a risk that you're going to die early. And that was eye-opening. And so that came down to, that's the first time I saw, I felt like this was a money game. And that was disheartening.
Definitely. No question about it. What would you say, Dr. Reed, is the number one thing you would want people to know about diabetes that they either may not know or they may not think about directly, simply because they're not impacted by by the disease itself, or know someone with type 1 or type 2? Something we haven't talked about today. What is the number one thing you would say that people should know about it?
Yeah, I mean, I think people can live a normal life with diabetes, and just the hard part is acquiring insulin and figuring out how to control that, I guess, the cost, and bring down the cost to treat the disease, because there are people that are dying because they don't have their insulin, that are rationing their insulin, and it's slowly killing people. And to me, that's the biggest issue presented right now, is how to make, how to make it affordable for people to treat the disease that they have no control over. They didn't eat too much candy, or they didn't, live a certain lifestyle, and that's why they have this disease. It's just bad luck. It's an autoimmune disorder, and there's nothing you can do about it. You just have to live with it and learn to treat it. So I think trying to find a way to, make that affordable, or for people to treat the disease.
Dr. Reed, thank you so much for joining us today. We really appreciate you sharing your story and sharing your insights as a type 1 diabetic, as somebody in the medical profession. Thank you very much, and best of luck to you with everything moving forward.
Yeah, same to you, Brandon. Thanks for having me.
Thank you.